wonderful, fantastic table, so I'm surprised they're not all running up here to do this instead of me. But lots of expertise. And one of the things, our issue was communications. And one of the things in looking at communications, the challenge is really immense. And the potential to create change from communication is really far-reaching. And one of the things that we also discovered as we started working is we have lots of different type of expertise at our table. And there are a couple of different ways to approach communications because it's so multifaceted. And we spent some time as a group really working through those two sides. The first one really being in-country. If you look at in-country and the dramatic change you can make with communication to help stop spread, and to really look at containment in a new way through individual behavior from the patient to the caregiver to health workers to responders. It's really tremendous. Then we also looked at that second part, which is if we're able to effectively tell that story, we can call people to action here today. And that really has a tremendous impact. And with the folks at the table, based on our resources, we really looked at the latter. Really look at that challenge of think globally and act locally. The issues that we wanted to solve were some of the things that we heard about this morning, which is the stigma, the miscommunication, the lack of understanding about actual health risks and what are some of the challenges and what's really happening overseas. Also apathy. Also issues about how folks are treated here, the story about the person exiting the cab. How do we treat health workers that are returning, and how do we really get through those issues? And also, how do we get attention? And how do we maintain momentum? How do we find relevancy enough that people will take action? And our value proposition that we focused on is really how do we channel all of this effectively for individuals, corporations, and others in our communities to act. We had a lot of really good ideas on how to do the targeted population. We want to reach the general population as a whole, but we want to start in our own backyards. We had a lot of good discussion that while all of us are here today, that people in our own companies may not really know what the issue is, they may not be part of it, or even aware of what our company is looking at to change. So starting in our own backyard, working with our human resources specialists, working with our corporate social responsibility experts, and then really looking at what our communication tools are to reach the general public. Who are the partners we already work with, and then what are the channels that we can leverage and really take advantage of to get our message out. Key players would be our chief communication officers, media, HR, marketing director, corporate responsibility. And really the biggest thing for us is how to make that, to use storytelling really to make it relevant. And then the call to actions we looked at were things like, can we develop a program around the heroes that are serving overseas and the people that are really donating and volunteering time? Can we also look at ways where we can give every person an opportunity to get involved, spread the word about how transmission really happens, accepting people, and then also looking at ways that everybody can donate or help become part of the effort. So I'm sure I didn't capture all of it, but much credit